can we reasonably assume that the current system of health care in this state truly allows for the people, all the people, to pursue their highest calling? Is there a responsibility? And to what degree is there a responsibility for those who govern to protect the life of the governed? I think the governed deserve to be protected in their quality of life, and HB 311 does that. There is a strong link, culturally and legally, to the Judeo-Christian ethic, and its moral imperative is simple: love thy neighbor. That, again, is the issue of health care and the well-being of the people. Civil religion and the Judeo-Christian ethic form the moral basis, or should form the moral basis, for our policy decisions. The question then is, what are the values of those who govern? This legislation is a wonderful piece of legislation, but this legislation to me is a litmus test of the question of our values as legislators and as constituents. We all know the current system doesn't work. And I have my own horror stories that I'm not going to get into. Ask me a question. 1.8 million Illinois residents with no insurance. We heard about the 40,000 who had insurance but lost everything through medical bankruptcy. An infant mortality rate in the African American community of 14.1 per 1,000 live births, a rate that would rank 92nd in the world. The U.S. in general is 48th in the world. And by the way, all of the top 30 are all single-payer systems. What values does this communicate? We spend time, effort, and vast resources to lock up young men and add to the crisis. We refuse to solve poverty. We insist on war rather than provide decent health care to pregnant mothers and others who need coverage. Are these our values? We can no longer afford to say if we should or should we do it. It is time for us to shift our language to a language of hope that says we will pass HB 311. We will provide health care to all citizens of this state. The time for asking if we should is past. The moral imperative says we must, and we must do it now. We have a simple choice to make, I think. It's a simple declaration of our values. If we value unrestrained profit at the expense of the lives and well-being of the people, then legislators should be forthright and tell the people that their values are shaped not by the Declaration of Independence, not by the Constitution, not by the Judeo-Christian ethic, but rather by the quarterly profit and loss statement of Merck, Pfizer, and the insurance companies. If the values of you, our legislators, is to be prisoners of the neoliberal corporate agenda, which is a very effort to, listen to me now, because since 1950 in the Chicago school led by Milton Friedman, the whole goal has been the privatization of government itself. Okay? So if the values of our legislators is to be prisoners to that, then they disqualify themselves as an advocate of the people. If we value our most precious resource, our human capital, if we value each individual human being as a person deserving of dignity, then we must say yes to this legislation. If we value the moral imperatives of both civil religion and our Judeo-Christian ethic, then we must say yes to HB 311. If we value the future and health and well-being of our children, we must say yes to this legislation. Because if this legislation is wrong, the Constitution is wrong. If healthcare for all is wrong, then the Declaration of Independence is wrong. And if providing access so that the physical well-being of the people can be uplifted is wrong, then God is wrong. It is a matter of values. In closing, I strongly urge you to pass this legislation. We're entering an era that in one sense is very bleak, with more and more people losing their health care, their health coverage, their health itself, and in some cases their lives. Why and for what are they losing it? Not because there was no system, but because there was no access in the system. Our overall population is getting older, and that places more strain on the system, and unless it is changed, it will only get worse. My mother was born in this state, now is retired in this state, and her ability to live on a fixed income with her various medical issues that she has means that at 73 years old, she is not looking forward to a future of healthy joy, but a future of pain and painful choices. I was glad to hear about the legislation that was just passed, because as a pastor, I have several young men in our church who are in their 20s who aren't covered by their parents, who have zero coverage. What happens to them if they get sick? What of those who are part of the growing army of the working poor, who don't have coverage through their employer? We have to reprioritize government. The priority can no longer be tax breaks for Boeing and no health care for 1.8 million people. The legislators took an oath, and the oath means something. And this legislation meets the fiduciary and the moral standards for giving proper health care to all the people of this state. And what happens to this legislation will be a telltale sign of the fitness of our legislators to hold up the social contract that exists between them and the governed, which are all the people of this state. So I close here and pray that, and I know you are, so I'm talking to the camera, they are, but I will close here and pray that you will act in accordance with the moral rightness of this legislation, and that as legislators you never forget this. You cannot love the people if you do not serve the people. And you cannot lead the people if you do not serve the people. Thank you.